Aloha! This is Fyra Seishin Cabalquinto, a BS Criminology second-year student at the University of Cebu, Banilad campus. For today's video, we will going to tackle about the different types of first aid measure for selected situations. Here are the selected situations. We have shock, drowning, wound, fracture, burn, heat injury, poison, snake bites, dog bites, allergic reactions, anaphylactic shock, nose bleeding, hyperventilation, choking, dizziness, and seizures. First situation is we have shock. A shock is a condition resulting from a depressed state of many vital functions. Vital functions are depressed when there is a loss of a significant amount of blood volume, a reduced blood flow, or an insufficient supply of oxygen. Signs and symptoms of shock: sweaty but cool skin, paleness of the skin, restlessness or nervousness, thirstiness and dry mouth, fast and shallow breathing, dilated pupils, rapid pulse, nausea or vomiting. First aid measure for shock: controlled bleeding, replacement of fluids, prevention from heat exposure, NPO or nothing by mouth to an unconscious patient. Loosen the clothing, lay the person down, alleviate the casualty's feet higher than the level of the heart or the shock position. Begin CPR if the person shows no signs of life, such as not breathing, coughing, or moving. Drowning. Drowning is a type of asphyxia or the inability to breathe, related to either respiration of fluids or obstruction of the airway. This is caused by spasm of the larynx while the victim is in the water. The major cause of accidental death occurring in swimming, diving, and water activities. Drowning can also occur in home pools, bathtubs, wash tubs, washing, and in shallow water. First aid measure for drowning: open the airway by tilting the head and lifting the chin. Open the mouth and check for any obstructions. If there are no obstructions, look at the rise and fall of the chest. Listen for breaths with your ear close to the nose and mouth of the victim. Feel with your cheek for air coming from the nose and mouth. If the victim is breathing, place him or her in the recovery position. If the victim is not breathing, perform cardiopulmonary resuscitation or CPR. Wounds. A wound is a break in the continuity of a tissue of the body. It's either internal or external. Wounds are classified into two: the open wound and the closed wound. In this video, I will be showing you a type of an open wound, which is the lacerated wound. Lacerated wound is caused by jagged, irregular, or blunt objects. First aid for open wounds: direct pressure, elevation, pressure on the supplying artery, tourniquet, dressing, and bandaging. The next situation is the fracture. Fracture is a break in the continuity of the bone. Generally, a fracture comes in two kinds: the open and closed fracture. Signs and symptoms of fracture: deformity, tenderness in the affected area, swelling, pain, presence of a protruding bone, inability to move the injured part, bleeding, discoloration in the affected area. First aid measures of fracture: stop any bleeding, apply pressure to the bone with a sterile bandage, a clean cloth or a clean piece of clothing. Burn. Burn occurs when a tissue is damaged as caused by excessive heat, electricity, radioactivity, or chemicals that corrode The proteins in the skin cells. There are 3 degrees of burn. First degree, it involves only the epidermis, causes mild pain and erythema or redness, no blisters, and skin functions remain intact. Second degree, destroys the epidermis and part of the dermis. Some skin functions are lost. It causes redness, blister formation, edema, and severe pain. And lastly, the third degree destroys the epidermis, dermis, and subcutaneous layer. Most skin functions are lost. This varies in appearance from marble white to mahogany to black. The burned area may be numbed because the pain sensory nerve endings located at the dermis are destroyed. First aid treatment for burn. Remove rings or other tight items from the burned area. Hold the burned area under cool, not cold, running water or apply a cool, wet compress until the pain eases. Try to do this quickly and gently before the area swells. And do not break the blisters. Allergic reactions. Allergic reactions occurs when a person's immune system reacts to normally harmless substance in the environment known as allergens. Most common allergens are insect stings, certain food, medications, pollen, plants or flowers, dust, and fibers. Signs and symptoms of an allergic reaction. Hives, red, elevated, irregular shaped spots on the skin. Itchiness, nasal congestion, rashes, red, watery eyes, or rhinitis. First aid for an allergic reaction. If the symptoms are mild, give an antihistamine by mouth such as diphenhydramine or Benadryl. If the symptoms are severe and you have injectable epinephrine such as EpiPen, use it as directed right away. Anaphylactic shock or anaphylaxis. Anaphylactic shock is a sudden and severe allergic reaction that occurs within minutes of exposure to the allergen. Immediate medical attention is needed for this type of reaction because it can cause death in less than half an hour if untreated. Signs and symptoms of anaphylaxis: high-pitched breathing sounds, chest tightness, cough or difficulty in breathing, dizziness, nausea or vomiting, abdominal pain, redness and swelling of the face, hives and itchiness on different parts of the body, and unconsciousness. First aid for anaphylaxis. Seek medical attention immediately. Calm and reassure the person having the reaction. Do not wait for the reaction to worsen. If the person has allergy medication in hand, help the person take or inject the medication. Avoid oral medication if the person is having difficulty in breathing. Nose bleeding or epistaxis. Nose bleeding is a relatively common occurrence of hemorrhage from the nose. Usually noticed when the blood drains out throughout the nostrils. There are 2 types, the anterior or the most common and the posterior, the less common, more likely to require medical attention. Possible causes of nosebleeds: infection, trauma, allergic rhinitis, blood thinning medications, blood diseases such as hemophilia or anemia. First aid for nosebleeds. Pinch all the soft parts of the nose together between the thumb and index finger and press firmly against the bones of the face. Lean forward slightly with the head tilted forward. Leaning back or tilting the head back will cause the blood to flow into the throat and can cause choking. Hold the nose for at least 5 minutes. Repeat as necessary until the nose has stopped bleeding. Sit quietly, keeping the head higher than the level of the heart. Do not lay flat or put your head between your fingers. Apply ice, wrap it in a towel to the nose and cheeks. Hyperventilation. Hyperventilation is also known as overbreathing. It is breathing in excess of what the body needs. The normal rate of breathing is 16 to 20 breaths or cycles per minute. If the respiration rate of a person is above that range and the signs and symptoms are present, the person may be suffering from hyperventilation. Signs and symptoms of hyperventilation: chest pain or discomfort, dizziness, feeling of choking or suffocation, anxiety, fast breathing, muscle spasm in the hands and or feet, weakness, and palpitation or rapid pulse. First aid for hyperventilation. Remain calm. The first aider needs to calmly instruct the patient to breathe deep, slowly, and normally. If the first aider panics, it might cause more anxiety to the patient. Instruct the patient to perform deep breathing exercises or DBE by inhaling through the nose and slowly breathing out through the mouth with pursed lips, like blowing a candle. If the patient fails to follow the instructions, use a brown paper bag to compensate the high amount of oxygen in the system. Cover the patient's nose and mouth with the brown bag and allow him or her to exhale and inhale inside the bag. Position the patient sitting down with knees bent towards the chest and with the head leaning forward and touching the knees. This will promote circulation to the different parts of the body. If symptoms persist after several minutes, seek medical attention. Choking or airway obstruction. Choking is the blocking of the airway that occurs when a foreign object gets lodged in the respiratory tract. It may be partial or complete. To determine whether the obstruction is partial or complete, ask the patient if he or she is choking. If he or she is able to talk, then the obstruction is only partial. However, if the patient is unable to talk, then the obstruction is complete. In this video, I will be showing you the first aid for partial obstruction. Calm the patient. Anxiety may cause him or her to move unnecessarily, and it may cause the foreign object to move further into the respiratory tract and cause a complete obstruction. Instruct the patient to forcefully cough out the foreign object. Do not attempt to reach into the throat of the patient with your fingers and swipe the foreign object. This may cause the object to be pushed down into the windpipe. If coughing is ineffective, assist the patient by delivering several back blows between the shoulder blades with the heel of your hand. Observe for complete airway obstruction. Dizziness. Dizziness is a word that is used to describe two different situations, such as lightheadedness is a feeling that you're about to lose consciousness or faint. Vertigo is a feeling that you or your environment is moving or spinning, but there is no actual movement. First aid for dizziness. Let the person sit or lie down. Lightheadedness is usually relieved by lying down. Avoid sudden changes in position. Let the person drink fluids if there is no nausea or vomiting, and call for medical assistance if dizziness is not relieved after several minutes. Seizure. Seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in your behavior, movements, or feelings, and in levels of consciousness. If you have 2 or more seizures or a tendency to have recurrent seizures, you have epilepsy. First aid for seizures. Stay calm and reassure bystanders. Loosen anything around the person's neck that may impede breathing. Do not restrain the person, because this may result in injury. Do not put anything into the person's mouth and do not try to hold the tongue or force the mouth open. Clear the area around the person and remove any objects that could injure them. Put something flat and soft under their head. After the seizure, lay the person on their side to facilitate breathing and keep the airway open. Do not leave a person alone after a seizure, because they may be disoriented or confused. If the person is known to have epilepsy, it may not be necessary to call 911. However, call 911 if the seizure lasts longer than 5 minutes. That's it, guys. I hope you enjoyed and you have learned something from my video presentation with regards to first aid. Thank you and God bless.